the bottom sheet a little bit, pulled up the top sheet, and then what I did is then I put this little towel, I tucked it in, and so, and then to check, he did like a clam. Can you come up? Yeah. And to make sure his, yeah, right? To make sure, clamshell,
Yeah,
to
I
make
got it.
sure his trochanter is exposed. So that's the only, and I did it in the wide open room, so nobody, you know,
Yeah.
anyone could have walked by and it was fine.
Right.
So you guys need to practice this, and,
Mm-hmm.
and both, the men and the women, because you could get Dina, you can get sometimes our other students come in, you can get Mike, you can get, so you need to practice this and make sure you're comfortable, because if you're uncomfortable with it, your patient's gonna pick up on that, because it's really not a big deal, right? If both his pair of shorts were loose, we probably could have just picked it up over and done this. So a lot of times if I know what I'm going to do, I'll tell my patient, can you wear loose shorts or whatever, and sometimes it's easier, but this.
I did just pull it up and over.
Oh, okay, the top
That's
ones,
good
yeah.
enough, yeah.
So, there you go. All right, but sometimes they have to scoot them down. So, did you scoot the top ones?
No, I pulled them both up.
Okay, so that's what he
Oh.
did. All right, there they are there, okay, all right. But sometimes they can, sometimes they have to scoot them down a little bit. But you have to expose, so thinking about a greater trochanter, so if it's a chronic issue, what would be your settings? So what would be your frequency, first of all, for the greater trochanter? Why? It's deep, it's a bursitis, right? Trochanteric bursitis, that's what it is. So it's definitely 1. If it's a chronic issue, how about duty cycle?
20%.
Chronic.
Oh, chronic. It's
100% or continuous, and your power or intensity is 1.0 watts per centimeter squared. If it's an acute trochanteric bursitis, it's still a 1 megahertz for the frequency, but your duty cycle becomes a 20% and your intensity becomes a 0.5 watts per centimeter squared, but it's always deep. So you can't really treat, I don't see how you can be effective and treat a trochanteric bursitis with moist heat. It's not gonna get to the source of the tissue. But remember I said if someone keeps coming in with a trochanteric bursitis, you need to look at their alignment. It's usually like an anterior posterior alignment of the pelvis. It's like a muscle energy thing. Maybe they've got tightness in their band or something like that. Something else is going on. You can't keep just treating this and people getting inflammation without getting to the source, right? So does that make sense? So I want all of you to end up trying this. And what happens is when I pull this up, so this here, and this, I just want to show them how it overlapped. So I actually put, here's the bottom sheet, and I actually doubled it because sometimes these are thin, and here's the top sheet, and that's what I did. So I had them like this. I said, can you pull your shorts up or down? And then I did this, exposed just an area, and then I threaded the towel through just like this. So if you get gel, you get the gel on the towel, and I made a little hole. Does that make sense? Bring it around, and then just to double check, you have them do the clamshell again to make sure you're right on it. Good?
Yes.
All right, thank you for doing that, appreciate it.
No problemo.
So make sure everyone tries that. All right, so you can pull them down.